Well, many Americans suffer from chronic migraines with only temporary relief. Neurologist Dr. Stephen Landy with the Headache Center is here to tell us more about the services his clinic offers. Start by telling us, for people at home who may only know it just as a really bad headache, I mean, this is a pretty serious medical condition.
You betcha. It's a very serious medical condition, and every migraine patient presents in their own way, manifesting usually with a unilateral throbbing headache. But in addition to the headache, a lot of nausea, sometimes vomiting, and light and sound sensitivity.
So tell me a little bit about what services are out there to treat them, because I've always heard that you really can't do much with a migraine except get somewhere where, you know, there's not a lot of light and take some Tylenol or something.
Yeah, there's a lot we can do nowadays.
Okay.
And Baptist Hospital has made sure that we are going to optimize what we can do for these unfortunate patients. And we have medications that have been designed specifically to address the migraine pathophysiology.
Okay.
There's a lot of inflammation, there's a lot of swelling of blood vessels, which cause a lot of pain. And we can address that with up-to-date medications.
Wanted to ask you this question. When should you call the doctor? When do you realize that that headache that is making you sick to your stomach is a little bit more serious than just a headache that's making you sick?
When you're disabled.
Okay.
When you can't function normally, when an over-the-counter medication really isn't working optimally, or when you're having some type of focal neurological problem, like a numbness in one extremity, a weakness in one extremity, maybe some confusion, maybe some depression of your mental status, I think it's time to move on, go to the emergency room, or at least make an appointment with your healthcare provider.
Give me a feel when it comes to migraines. What do you find that is most surprising? I don't know, when people come and sit down and talk with you, what's like the biggest surprise that maybe people at home may not even know? That
migraine is more than just a headache. Frequently there's an aura, some type of visual phenomena or sensory phenomena that precedes the migraine. Sometimes there's a change in their personality, hours to days before the migraine headache occurs. And also what has surprised me through the years is how disabled these migraine patients are. And luckily, how easy it is to treat some of these patients with up-to-date treatments, including many of our new medications.
So the toughest step here is just ultimately getting to the doctor's office, psyching yourself up to know that, hey, this is a little bit more serious than just a regular run-of-the-mill headache.
Yeah, it's time to go see someone and get some help that's readily available.
Okay. Tell people where they could find you or some of the other doctors at Baptist.
Well, I work with the Baptist Medical Group, which is part of the Baptist Hospital, and I'm at the 6029 building on the main Baptist Hospital campus, Baptist Memphis, or we used to call it Baptist East.
Okay.
And I would just love to see any patient that thinks I'm the right person for them.
Okay, and again, with talking about some of the symptoms like mood changes, health changes, wow, that's pretty eye-opening stuff.
Thank you.
All right, doctor, thank you.